Infections are very common, and having the right experts who have the expertise in these areas is very important. And we are a very diverse group with a lot of different subspecialty experiences. I'm also the sepsis director at Loyola Medicine. Sepsis is a very deadly disease. It's the most common disease walking to the emergency room. Almost 2/3 of the patients coming there. And it also has high mortality. It acts as deadly as trauma and strokes together, and it's 3 times the heart attack deadliness. Prompt response to sepsis is a very important thing. Sepsis is an immune response in the body, typically to an infection, but could be to other causes, where you might have fever, you might have high heart rate, high breathing rate, your blood pressure might or might not be stable, your white count will be up, and then you'll be having a source of an infection. If you don't control it very quickly, the sepsis becomes its own process, and it carries on with more organ damage, and this is what we fear. Like the infection is treatable, but then the sepsis it creates becomes the lethal disease that you have. And jumping on that as soon as possible saves lives. Making people relax is the most important thing, because that's who they are eventually. They're outside of being here as a patient, are people with stories, and bringing that to their attention even makes them feel that they actually are being listened to as people and not just as patients.